And welcome back to Decoding Life. Today, we're tackling a topic that's often overlooked but incredibly important. Tongue cancer. Is that tongue sore just an accidental bite, or could it be something far more serious? Tongue cancer can start silently, and its early signs are often dismissed as minor irritations. This delay in recognition can have significant consequences, as early detection is key to effective treatment. Many people don't realize how subtle the initial symptoms can be. A small patch, a tiny bump, a bit of soreness. It's easy to think, oh, it'll go away on its own. But what if it doesn't? Ignoring these signals can allow the condition to progress. Understanding what to look for empowers you to take control of your health. Let's decode what to watch for before it's too late, so you can protect yourself and your loved ones. So what is tongue cancer? It's a type of oral cancer that originates in the cells of your tongue. Given its constant use and exposure, the tongue is a site where cancer can develop. This type of cancer most commonly develops in the squamous cells which line the surface of your tongue. Squamous cell carcinoma is the most prevalent form of oral cancer. Tongue cancer can appear on the front two-thirds of the tongue, oral tongue cancer, or at the base of the tongue, oropharyngeal cancer. Oral tongue cancer is often easier to spot due to its visibility. Symptoms might include a persistent sore, a lump, or a change in texture or color. Base of tongue cancer can be more insidious, with symptoms like persistent sore throat or difficulty swallowing. It's the stage for recognizing the specific signs we're about to delve into. Now, let's get into the critical part, the early signs of tongue cancer. Many of these symptoms can seem quite harmless at first. However, the key difference with cancer-related symptoms is their persistence. One of the most common early indicators is a persistent red or white patch on the tongue. These patches are not sores, but changes in the color and texture of the tongue's surface. Any such patch lasting more than 2 weeks needs a professional evaluation. Another significant sign is a sore, ulcer, or lesion on the tongue that doesn't heal. A sore related to tongue cancer will persist beyond a couple of weeks. The development of a lump, bump, or a thickened area on the tongue is also a cause for concern. Persistent pain or a burning sensation in the tongue or mouth should be investigated. Difficulty or pain when swallowing or changes in your speech can be indicative of a tumor. Other symptoms include unexplained bleeding, numbness, or persistent bad breath. Each of these signs, especially if persistent or occurring in combination, warrants a prompt visit to your dentist or doctor. Early detection is vital for effective treatment. So what's actually happening inside the body when tongue cancer begins to develop? It all starts at the cellular level, specifically with the DNA of the tongue cells. When DNA is damaged or undergoes mutations, it can disrupt normal cellular. As these abnormal cells continue to divide, they form a mass of tissue known as a tumor. Initially, this tumor might be very small, but it can grow larger and invade surrounding tissues. The tumor can start to affect the tongue's function, leading to symptoms like pain or difficulty moving the tongue. If not caught and treated early, the cancer cells can spread beyond the tongue. Underscores the urgency of recognizing those early signs. And understanding who is most at risk for developing tongue cancer can help individuals and healthcare providers be more vigilant. The most significant risk factors for oral cancers are tobacco use and heavy alcohol consumption. Tobacco exposes the cells of the mouth and tongue to carcinogens, damaging the DNA in these cells. Heavy alcohol use can irritate the cells lining the mouth and throat. The risk is particularly high for individuals who both smoke and drink heavily. Infection with certain types of the human papillomavirus, HPV, is a significant risk factor, especially for cancers at the base of the tongue. Chronic irritation to the tongue or mouth lining can also play a role. Maintaining good dental health and ensuring dentures fit properly are important. Preventive hygiene, a family history of oral cancers, and a diet low in fruits and vegetables. Awareness of these factors is key for prevention and early screening. If tongue cancer is suspected, a series of diagnostic steps will be recommended. The first step is usually a thorough oral examination by a dentist or specialist. If a suspicious area is found, a biopsy is performed to take a small sample of the abnormal tissue. The tissue sample is then examined under a microscope to check for cancer cells. Once cancer is confirmed, imaging tests determine the size and location of the tumor. Common imaging tests include a CT scan and an MRI scan. For some cases, a PET scan may be recommended to check for spread to distant parts of the body. Testing the tumor tissue for HPV is now standard practice for base of tongue cancers. Knowing the HPV status helps doctors tailor the most effective treatment plan. Understanding these steps can help demystify the process and prepare you for what to expect. Risk. Quitting tobacco and limiting alcohol consumption are the most impactful preventive measures. Maintaining excellent oral hygiene is also crucial. Regular dental visits are vital for early detection. Getting the HPV vaccine is an important preventive strategy. Performing a monthly oral self-examination is a powerful tool for early detection. During your self-check, look for red or white patches, sores that haven't healed, lumps, or unusual pain. If you notice anything suspicious, make an appointment with your dentist or doctor promptly. Early detection through self-checks and regular dental visits can make all the difference. Empowerment comes from knowledge and action. We've covered a lot of ground today, from understanding what tongue cancer is to recognizing its early signs and knowing the risk factors. The key takeaway is the profound importance of awareness and early action. Tongue cancer, when caught in its initial stages, is often highly treatable. The challenge lies in its often silent or subtle beginnings. Remember that persistent little sore or unusual patch might be nothing, but it also might be something. Your body has ways of signaling when things aren't right, and it's up to us to listen and respond. Early detection can genuinely save your life. If something feels off, schedule that appointment with your dentist or doctor. Thank you for joining me on Decoding Life today. Stay safe, stay informed, and I'll see you in the next video. Like, comment, and subscribe to Decoding.